Building a successful clinic takes more than great medicine. It takes vision and the courage to innovate. My guest today, Dr. Brandon Maijala, he is a respected foot and ankle surgeon and the vice president of the Los Angeles County Podiatric Medical Association, South Harbor. In just few years, he turned his Anaheim practice, Care Podiatry, into a model of modern patient care healthcare, combining surgical expertise, community leadership, and technology and the post-op art box that he got for himself for the patient experience. We are going to unpack his journey, how he balances medicine with entrepreneurship, and what it takes to build a thriving practice in today's healthcare world. Dr. Maijala, welcome to Healthcare Business Growth Conversations.
Thank you, Rakesh.
Yeah, I want to start from the top. Like, you have grown Care Podiatry into a thriving practice, and Anaheim has become your anchor location. What was the vision when you started out?
When I started out, I wanted to really focus on patient care. I wanted to bring back care into healthcare. I noticed a growing shift and change into less community-based doctors or patient-centered doctors and more into profits or corporation-based ideology. So I knew I wanted to do a private practice, one that was focused on the communities where I live.
Got it. That's interesting. And then I love the way that you said you want to bring care into healthcare. That has a deep meaning. So, a lot of doctors struggle to separate their clinical identity from their business role. How do you balance being both a practicing surgeon and a business owner?
It's difficult. It's very hard task to do. Both of those take a lot of skill, but having a good team beside you, being very organized and making sure that you take time for both of those things to make sure that your skills at both managing an office as well as managing your skills in surgery are attended to. It is something that you can.
Yeah, right. Now, I think focusing on the right team and setting up the right systems is the way to go. So, and you are also the vice president of the Los Angeles County Podiatric Medical Association. That's no small role, right? I imagine being in that position gives you a bird eye view of where podiatry as a profession is heading. Now, has that perspective influenced you, how you lead your own team in your practice?
It helps me stay connected with the profession and then connect more with, my colleagues throughout California, especially at the sponsored events like the Western that's happening once a year. It's a large trade show that I try and go to every year, and also with delegation too. It helps me bring awareness to our profession. And then also it helps me help out our profession by potentially influencing future laws or things that can lead to reimbursements for our profession.
Got it. So, let's talk something that really fascinated me, the post-op part box. Now, I was really surprised, whenever I heard it and then when I looked at it. So, where did that idea come from?
It came from when I was in residency. And as a resident, I worked under and I was being, trained by a lot of different surgeons. And post-operative swelling is a big issue with any foot or ankle procedure that's done. Swelling is one of the most common side effects and can last the longest. So a lot of my attendings would recommend different products and different things to help decrease the amount of post-operative inflammation and long-term swelling. I found the ones that I found were the best, and I curated the products and I tested them myself, and I created a kit that people can then use after surgery. Now that I'm out and doing my own surgeries, I give this to each of my patients just to help with the pain and swelling post-operatively. And it's just a way that, we can do a little bit more to help people be cared for and in less pain.
Well, that's brilliant. And what like about it is how intentional it feels. It is not just a product, it's a part of a patient experience strategy. So I really liked it. So, let's say, if I were to visit your Anaheim clinic tomorrow as a patient, now what would stand out? How do you create a strong patient experience at your clinic?
Well, as soon as, We try to make it as easy and less stressful as we can for the patients. They're already stressed because of whatever injury or ailment that they're having. If there's check-ins available that we made mobile so that you can check in on their phone. You can also check in right outside the clinic. We have a QR code. We have a very open waiting room, so it doesn't get too crowded. I don't like people being crowded or waiting. So another thing is I only book 30-minute slots for each patient. I don't, at this time, I'm not double booking anybody. They all get their own time slot. That way that I can, have that time for them and not have to go to another patient. We also, once you get in the room with me, I don't bring in a computer in. I do have either somebody else there scribing, or I have a tablet with either virtual scribe or a scribe recording so that I can focus on you, the patient, and talk to you one-on-one. And there's nothing between you, me, and your issue.
So that's really care, right? Like that's your strategy. So just make sure nothing else in between the patient and the doctor, just focusing on the care. As you said, in the healthcare, that's what you wanted to bring. And then that's what you're preaching and that's what you're doing. That's impressive. And also, I noticed that you wrote Surgery in Podiatry book. That's an impressive accomplishment. So did that process change how you communicate with your patient or staff?
That's a good question. Writing is a whole different. Writing for other people is very different than writing for yourself. Whether you're in medical school or residency, you write to help you learn and remember. But then when you're writing for somebody else, you have to use language that will help your audience learn and remember. And that is a key thing that I think that helped me with, is that everyone hears things a different way. Everyone remembers things through different ways. So it helped me, more like a soft skill when talking to patients, realize that I have to speak in a way that'll get them to hear.
Got it. So in a sense, writing forces clarity, and then that helps you to think in clear. So that's really a good way. That's an impressive accomplishment. So on the same line, for smaller single doctor practices, what are the one or two low cost ways they can elevate the patient experience?
That's also a great question. I think one of the ways that we had use is using this is a very specific example, is using a virtual assistant. That takes a lot of the kind of the back end work that you would be doing instead of providing patient care off of you. It can help with telephones, insurances. It's helped tremendously.
Well, that's good. You're just delegating the work that you are not supposed to do, and then you put it hiring a virtual assistant that also bring in that resource at a lowest cost possible. And in turn, that helps you to care the patient, and eventually you are creating that patient trust, giving them the comfort. And I think this is all you're creating that invisible marketing for your brand by following this, and it follows the word of mouth referrals as well. That's really that's a good advice that you have given. So like Anaheim, right? The location, I just wanted to ask about the location because it is such an interesting city, very active, young, fast paced. Like I was just searching about the Anaheim as a location, and then I just wanted to understand much more because now you are running the community, you have got families, you have got professionals, athletes, all with different needs, right? So how do you keep your care consistent while adapting to such dynamic patient base?
I think one of the way it is very dynamic, and it's a very large city. I'm just in like one small part of it, but yeah, Anaheim is huge. I have to specifically tell patients too where I'm at in the city of Anaheim because it's big. I think treating everybody with the same amount of care is the goal, and the way to do that for that different type of population. Just you can guess what kind of patient it's going to be or what kind of encounter it's going to be with them and how they're going to act, but you always get surprises, both good and bad. You'll think this person's going to be a really great patient, and then they come in and they're nothing but difficult. Or or the same thing. You have some, either internal bias or known bias to somebody, and you think they're going to be difficult, and then they come in and they're completely not. They're the best patient of the day. So trying to treat everybody as if they're going to be the best patient of the day, if that works for you, or that you're going to be the best doctor for them, usually helps me with that dynamic population.
Well, I love that you mentioned you want to be the best doctor for your patient. So that's a perfect setup where I want to go into next, because your clinic seems to adapt innovation early, especially when it aligns with patient outcomes. So you recently introduced some cutting edge technologies. So I just want you to talk about it, and also what convinced you that that was the right next step for your practice.
Yeah, there's a few things that we have that we use. Lasers for photobiomodulation tissues to help increase healing with things like skin fungus, toenail fungus is things that we've adopted. And that's, that's been around for not, relatively soon, but it's been around for a little while. I've used lasers for toenail fungus. I think the first time I was introduced to that was maybe 4 years ago, and it showed great results. That's currently evolving, and we're currently evolving with that and using different ways of doing that photobiomodulation. And we have some new stuff coming out soon, actually. Also, being a one-stop place. I don't want to be a primary care doctor, but it seems to be like my clinic and organization tends to kind of go that way because we are treating a lot more than just toes. We
Yeah.
have studies for check out vascular studies where things for nerve conditions. We're doing all systems of the body in and around the foot now. So it's it's comprehensive, and we're trying to do as much as we can for our patients.
Right. Like it makes sense from the care point of view, but I imagine a lot of doctors listening are cautious about adapting new tech, either because of the investment or uncertainty. So, what helped you to evaluate the ROI, right? And then you spoke about the patient impact, but from the business side, these are all the investments that you got to make. And then, I just wanted to hear your approach, making the decision, adapting this new tech.
I don't want to adapt anything that I haven't personally tried or seen, or it's been documented for, the efficacy has been documented for decades. Um, so that's like the trade show I mentioned, I like going and seeing and hearing other testimonials. And, you know, salespeople are good and bad. Their main job is to sell you something, but to get them to sell, sometimes they will give you trials. And then if you have patients that are willing to do trials, you can do trials of these products to see your own efficacy and, you know, tailor that with research that you've done or found elsewhere for the same. If you know, it just goes back to being what we learned in medical school, research where you can. And then once you find something that you think will help your patients, then research how to make it, a net positive for the business. Well, it does not make sense to do anything that's a net negative. Then you won't be in business. Then you won't be able to help anybody.
Well, now that's a very strategic way of thinking, not just technology for the sake of it, but as a part of a patient experience and in the journey. So, like,
Some of the technologies I said have just come out that we use, and then some like I'm actively building right now. And then there's some that we just got for our vascular studies that's been out for almost 2 decades. So it's not always the newest one is the best. It still works, and it's still good for the patients and good for the business.
right, that's a way to find a balance, right? Just care and the business. So when you look ahead, maybe 2 to 3 years from now, you're actively involved in associations and all. So what do you think will define successful podiatry clinics?
Uh, I think it's a good question. The scope of our practice is very different for each state that we're in. So there's certain things that I can do here in California that, podiatrists in, say, Montana can't do. I think I think all of us, getting, especially the ones with lower scope, rising up to the ones that are higher scope is one of the biggest issues in podiatry, as well as, getting people to know more about the profession. This is a great profession. I think it's a very good one to be in, both, for taking care of your patients, but also for, the quality of life as a doctor, and for this, whether we're limited into a region in our scope, but we can do a lot of things in that region. So I think there's a lot of variety in here. And I think expanding that variety and being able to offer more things to our patient is what I determine as successful. And I think, if you can own your own practice and stay afloat and then be the doctor that you want to be, to me, that's success.
With increases competition and doctors running their own, maybe single location clinic. Now, those doctors, right? What should be, they paying attention to?
Oh, yeah. They should be paying attention to their population, to their patients. Like there will be areas of this country where it's not feasible to do that. Unfortunately, it could be almost 100% of the population is under managed care, that it would not make it feasible to do it. You may have to join somebody and not open up. Unfortunately, there's not affluent areas of Anaheim, but there's also some very affluent areas near and around it that can help support a practice so that you could treat all those different populations. But if you're in an area where you don't have that wide variety of patients, it may not be feasible. So doing a patient demographic research on the area that you want to be in before opening up the type of place you want is very important.
That's an inspiring way to think about the future, like looking at the demographics, the patient experience, and then the innovations that you want to bring.
Location.
Got it. So, on the lines of running the clinic, what is the one mindset shift that changed how you run your clinic?
Yeah, it's interesting. It's the same and different. Like, you have to take care of yourself now more so. You have to take care of your staff and your colleagues more so than you used to. There's a lot of tasks or, being the owner that you don't have when you're not. A lot of little things that you don't know, and all of it, it does take attention. It does take you caring about things that you didn't used to not care about. And you have to then try and find a way to take, the care that you give your patients and then extend it to yourself and your employees as well. It's not easy unless you're just, that type of person. I don't know if I'm that type of person yet. I don't know how good I am at that. I try.
Yeah, it's not easy. That's why I said, it is a mindset shift. Treating a patient versus managing a clinic, both are totally different skills. What is the best investment you have made? I know not in terms of equipment, but something that changed your business.
I think, not in terms of equipment. I think Orange Care's been pretty good. It's pretty good. I don't want to lie or anything. I'm trying to think of something besides.
I'm glad to hear that.
I'm trying to think of something besides them. I think it's between Orange Carrot and the virtual assistant. Both of those things have really offloaded a lot of work that I would do that didn't lead directly to patient care. And it was just, a lot of stuff that had to be done to get where I wanted the organization to go, but wasn't super directed towards the patient. It was outside stuff that had to be done that just had to be done. And I'm not.
Yeah.
It's hard for me to focus if I'm not focused on the patient.
Yeah. Like that's Well, uh, that's the vision, right? Like to give the care. So
Yeah.
you got to focus on it. So
Yeah.
yeah, that's a good one. So what are the common mistakes that you see a new podiatrist make when they start their own clinic?
Yeah. Not being organized. 100%. The organization skills is not taught to people in medicine at all. We organize in clinical way, but we're not organized and learning how to organize an actual organization. It's a lot of times it's very linear things that we do, a stepwise approach to things that is not work with an organization, is very branching. So I think really trying to separate how you do things for your care patients and the clinical side, and then separate how you think about and how you organize for the structure of your clinic, your organization. You have to view them differently. You have to really plan out things more,
Got it.
especially with finances.
Definitely. On the same note, the patient experience and all, when we talk about it, the first moment of truth is the front desk. It's not you, right? So, whenever a patient walk in or whenever a patient make a phone call, no, it is not you who gonna talk. It is your front desk who makes that first conversation with a patient. So, how do you organize the front desk, or what is in your mind of now giving that experience to the patient, especially when you are not facing the patient as a first touch point?
Well, um, and right in our front window have uh, those sign, not sign, but a decal that has our name, Care Podiatry, and you can see it from the front desk. It's kind of all over on the front desk, but the very big first word in there is care. So,
Yes.
I tell everybody to care about them when they come in. And, the good thing for us is that has helped us and it's helped, um, you know, the experience for our patients. The bad thing is good and bad. Patients say, we hear positive feedback about it. You guys are one of the most caring clinics and doctors. And the bad part is they say doctors aren't like that anymore these days.
Got it. I'm really glad that you like the name Care Podiatry, because I remember working on a few names initially when we started working for you. So I'm glad that the name is working out. So,
Yeah. The first 10 seconds, I was like, I don't like it. And then after 10 seconds, I'm like, perfect.
well, that's now I'm glad to hear. So, and then finally, one piece of advice you would give your younger self, when you were just starting out.
Keep going. You'll get
That's
there.
it. Like, I just want to give an advice to your younger self. You started out this right after your college. I know you as a doctor, might have gone through a lot, studying a lot, and then evolved as a business owner. You might have made a lot of mistakes, learned a lot of lessons. So, what is it now? Even I made a lot of mistakes when I started out Orange Carrot
Yeah.
along with my partner. So we all have a story to tell. And then you as a doctor, that would be an interesting story. That's what I wanted to hear.
Well, thank you. Yeah, yeah. Maybe one day I'll write a book or another book.
Well, another book coming in. Okay. Definitely another podcast coming in about the book.
Yeah. Yeah. Let's do it.
That's
It
fantastic.
was great. This was fun.
Yes, yes. Now, I enjoyed the conversation. It has been a valuable conversation. Thank you for your valuable time. It is not just for me or for podiatrists, it is for anyone building healthcare brand with purpose. And your purpose is care. I'm glad to hear that. Thanks again for joining me on Healthcare Business Growth Conversations. Thank you for your time, Dr. Baila.
You're welcome. Thank you, Rakesh.